when you are as active and have so many passions in life. Hey guys, welcome to another episode of my channel, Hyped by Allison.
I'm not as hyped today
because I am going to be sharing with you the things I've been going through in the past couple years, because I want you to know before I go into my treatment this week, more about the things that I've gone through, and if I can help anyone out there along the way, I would absolutely love that, because I know how hard it is for your physical health to decline, especially when you are as active and have so many passions in life. On that note, it's not going to be a super hyped video. I start my treatment on Wednesday, and I'm going to try to document most of it as much as I can, kind of give an update every day. But it's Christmas time, and if I get better, that will be the best Christmas present ever in the time of Allison's life. All right, so as many of you may know, some may not know, I had COVID 3 times, and we're just gonna quickly do a backstory of before I got COVID. When I was younger, I had sinus infections all the time, and so I was always on antibiotics. I was always on steroids for inflammation. Like literally sometimes 2 to 7 times a year I would get a sinus infection, until in 2013 I decided to get sinus surgery, which definitely fixed the problem, and I've only had 2 sinus infections since. But I think that those antibiotics started a lot of issues, because after that I got mono twice, and I just always was inflamed. Like when I worked on patients, my upper body would always get messed up. I'd get a lot of injuries, running and whatnot. Either way, I learned a lot from that. Going into 2021, my family and I all got COVID. I mean, yeah, I was really sick and my lungs hurt and whatnot, but I thought I recovered well from it, and of course went on steroids for that, which definitely helped my lungs, but I would not recommend steroids because they lower your immune system, and mine was already probably not good. After the first COVID, I started getting stomach issues, like literally every month. My sleep got messed up. My sleep on my Garmin went from like 2.5 hours of deep sleep to like maybe 20 to 30 minutes of deep sleep, sometimes less. The stomach problems really were a pain, because they would come on and then I would have to go get this weird GI cocktail from the urgent care, and that was the only thing that made it better. It happened over and over and over, and it became kind of traumatic, but of course nothing traumatic compared to what I ended up going through after that. We ended up moving to Arizona and came back for Christmas. In the midst of that, I had COVID. The COVID part wasn't bad, but the aftermath, you guys, I started getting burning all over my body, but the burning was insane. We didn't know what it was. It was really scary. It took until the next month where I tried this peptide called thymosin alpha that got rid of the burning, but after that, I ended up having severe fight or flight. If you don't know what fight or flight, it's when your body like pumps out adrenaline, and I felt like I literally had a gun to my head 24/7 because the adrenaline was so high. I would go out on a run and I would have to stop and walk back because I just couldn't do it. My heart rate was so high, and I can't even explain like how it felt, but every run that I do, I'd have to stop and go to the bathroom on the trail. Not number one, guys. Then the next month, I literally had the worst PMS of my life, and I usually don't get PMS. I had severe cramps, I had severe depression, and in the midst of this, guys, I would wake up and feel like I did not sleep at all. Some nights I was up all night. Next, I started getting more of a histamine reaction to lots of different things. That eventually went away, but I continued to have bathroom issues and stomach issues. I ended up getting a sinus infection, but guys, in the midst of things, like I said, like I was exhausted all the time. I lost my appetite. I didn't sleep well. I put on a face and made my YouTube videos. We decided to move back to California. We moved back to California, and then more things happened. I started having blood sugar issues. I would wake up in the middle of the night in severe panic. At that point, I just decided to try Ativan, and that Ativan was not a good idea because it caused me, when I got off of it, to have nerve pain all over. That nerve pain wasn't going away, and we decided to research a supplement called NAC, and that got rid of the nerve pain but put me into a Herxheimer reaction. And now I know more about Herx's and why I react so much to NAC. It's because I have low mitochondrial function and my body has a hard time detoxing, so my body freaks out, and this is kind of a definition of a Herxheimer reaction. For me, it was pretty bad. I felt like I was dying. I only took 2 of those supplements. Finally, when I got out of that, I read that selenium helps after Herx, especially with NAC. Took that, caused severe tremors all over my body. After this, I developed a urinary tract infection, yeast infection, had to go on antibiotics again. Then, I'm just telling you these things because I had one thing after the other happen. This is not super detailed, but it is enough to show you that literally for 2 years, like, I've had a million different things going on. So yes, I took those antibiotics, that went away. I started this brain therapy that one of my friends recommended called Cereset, and it's supposed to get you out of fight or flight. I did that and it started to help. They recommended that I get off of my Zoloft, which I wanted to get off forever because it doesn't do anything for me, but when I try to get off of it, I have severe reactions. So started to get off of that, and guys, guess what? I started getting electric shocks in my hands, more nerve pain, and then let's move on to the third COVID, 3 years in a row. The beginning of January, got COVID again, and guys, my body was on fire all over. And let's rewind back to the second COVID real quick. I was in the ER after that, throwing up and having diarrhea for literally 2 hours every 5 minutes, and they sent me home saying nothing was wrong, saying I didn't have COVID, saying, I mean, it was after COVID, so that's why I didn't test positive. I was burning all over back then as well, and yeah, I was depleted. They just gave me Zofran. Okay, so fast forward to the third COVID, burning all over again, extreme fatigue, tingling all over. And let me remind you, since the second COVID, I literally had night sweats almost every night. I had maybe a couple months where I didn't. Yeah, I was trying to push through and run through all of this shiz. So third COVID, this is when it gets really bad. Had a really high fever for a while and very congested. COVID was pretty bad, even though people say it's not bad anymore. For me and AJ it was. He ended up getting kind of like a fight or flight thing too, and like one day we both woke up with severe adrenaline, but after COVID continued to have that adrenaline, continued to have severe night sweats, burning all over. I had been going to a functional medicine doctor who had put me on a ton of supplements, wasn't really guiding me, just throwing supplements at me. And she called me one day, and after I had told her my symptoms after COVID, and she's like, you have adrenal insufficiency. And me being so freaking desperate, went on bovine cortisol, which I recommend to you guys. Be careful about your adrenal supplements because this is literal cortisol. She claimed I had low cortisol, which was not true, and I was so desperate that I listened to her. And guys, my life got 10 times worse. My eyes started burning. I started getting tinnitus. I was in the ER several times with super high blood sugar and high heart rate, high blood pressure. You guys, like 150, 160 over 95. That's not typical for me. I'm usually like 90 over 70, sometimes like 100 over 70, but very far from my normal. 140 blood sugar, and I was in the ER several times. Yeah, stop the cortisol because I already had high cortisol. So then went to another functional medicine doctor, and he just handed me a ton of supplements, told me I had a sluggish liver and maybe a chronic infection. That's it. Most of the blood work was pretty normal except for some of my stress sex hormones, and I was very low in magnesium, very low in vitamin B12, and these will play in later to kind of what we figured out that I have. But this video is just more all about to tell you kind of my journey. I continued to just be in severe panic all the time, and it wasn't my brain, it was my body. So imagine like you can't help your body being in this severe panic, high heart rate, constant panic. Like I wasn't panicking about anything. I was only panicking about the fact that I couldn't control what my body was doing. Probably started from the cortisol, started getting severe pain and tightness around here, was in the ER for that one day, and of course they played it off saying it was nothing. Guys, I was so desperate, I decided to check myself into a treatment center because we thought it was anxiety. And guys, it wasn't anxiety because none of the meds worked. While I was in the treatment center, because of all the other meds that they put me on, I ended up getting a blockage, but that was also a problem. I already had something with my digestive system and the meds made it worse. Got an intestinal blockage while there, came home early because I knew that it was the wrong thing. Went to another doctor, started a med that shouldn't be a med I should be taking. I mean, I don't even need psych meds because I don't really have a problem. I do have anxiety, but I don't have bipolar. I don't have schizophrenic. Like they put me on a med for that because they said it also works for anxiety. And it worked for a month, and then I got akathisia. And akathisia is like torture. I got it 3 times because they kept putting me on and off different medications I shouldn't be on, plus the panic I already had. But I could go on and on. I got so desperate again, went to another treatment center that was horrible. horrible, horrible, horrible. I mean, I shouldn't have even been there. I just didn't know what was wrong with me, didn't know I had physical issues, and left there, decided to go to an internal medicine doctor, and there's a lot more in between all of that, but got off those psych meds and was a little better. Sometimes you get so desperate that you try those routes and you find out that is not the problem. So I went to an internal medicine doctor and he prescribed me low-dose naltrexone, which is supposed to help with panic, but it also helps with lots of different things. It's not a psychotropic, it's a medication that can treat autoimmune, it can treat MS, it can treat depression, it can treat so many things. And for some reason, I had a reaction to it, a bad reaction, kind of like another Herx. Although it did, in 2 days, get rid of my panic, and I think it's because it increases your endorphins, and whatever the cortisol did to me, like took away my endorphins and caused my body to be in like a severe fight or flight. I had my amygdala on at highest heights, and yes, I got another Herx. It was horrible. I had to take a peptide to lower my immune system because LDN upped my immune system, and I literally had like a severe fever and felt like I had the worst flu of my life for a month. Plus, not to be TMI, 6 weeks of severe diarrhea. We ended up moving. It was really hard because I was so weak and was starting to get burning all over my body again, and I just was so weak and sick, and we didn't know what was going on. Went back to the ER and they did a CT. My large bowel was inflamed. They assumed it was a infection and put me on an antibiotic. We're gonna put me on Cipro. I said no. Put me on Z-Pak. Went on Z-Pak. Started to get a little bit better, and then kind of went backwards again. We were desperate. Went to an urgent care and they said just go on Cipro. I had a bad feeling about it, but I did. I went on it, and I was stupid, and I was only on it for like 2.5 days. And guys, I developed edema in all of my body, and I still have it, and that was 10 weeks ago. Cipro is a no-no. Please do not take Cipro. Cipro will damage your body. It will damage your mitochondria. And yes, I have this wonderful, and guys know this is not flab, this is actual water, and I have it all over my body, and it is not fun and it is not attractive. So that has not gone away. So I have a quick update. I look a little ragged, but I'm like so tired from treatment. So what I thought was edema is actually muscle atrophy from Cipro, and I asked him, that can happen that fast, like literally in 2.5 days? And he said yes. That's why lots of people that get floxed from Cipro can't walk. Luckily I am not that far yet, not even close, but my muscles are all weak because they're atrophied from Cipro, and he's gonna fix it. My intestines have gotten worse. I literally went to the ER again with another blockage. Have had days where I can't go to the bathroom. Actually, weeks. Have gotten dizzy. The ringing in my ears has gotten louder. And I discovered ozone treatment. So I've been doing a little bit of that. Purchased a ozone generator and an oxygen generator. So I do ozone insulfation into my intestines. I guess you can guess where that goes. And that has been helping a lot. But that is kind of just letting you know just a little bit about what I've been dealing with. Along with, I can barely eat certain foods now because I have severe histamine reactions. My lips will turn bright red, my whole face will be red patches all over, itchy. So I can only eat certain foods. My face is actually doing well today, but that is kind of the gist of things. And currently the symptoms that I'm having are burning dry eyes, lips. The burning in my arms has actually gotten a lot better from the ozone. I get itchy a lot. I have the edema. I have intestinal pain most of the time. And guys know I don't have Crohn's. I have these weird growths in my eyes now. I have the tinnitus. I'm exhausted. I get dizzy a lot of the time. I have ear pain. And yeah, I think most of this comes from COVID, but there are a lot of similarities with COVID and Cipro, and that has to do with the damage to the mitochondria, which we will get into later. And that is kind of what the doctor that I'm going to focuses on. He treats a lot of people with Cipro damage as well as long COVID, vaccine injuries, and whatnot. So I am going to be taking you along. We have 2 days, less than 2 days. I start on Wednesday and it's Monday, and I'm super excited. I'm very, very nervous because I want my life back so bad. I thought I'd cry on camera, but I'm not. I cry to myself all the freaking time, but I'm forcing myself to do this video because if I can help anyone out along the way, I would love to. Obviously, I don't have all the answers. I have found one, and that is ozone. Also, the Hocat sauna, been doing that. That has been helping a lot as well. We'll talk more about that later, but we're just gonna go ahead and end the video. video, and I will continue it with my first day of treatment. I'm not sure if I'm gonna start treatment on Wednesday. I'm gonna for sure see the doctor, and it's like a 2-hour long visit, but I will tell you about that, take you along, and then when I actually start treatment, we will make sure that I can, and if I can't bring my camera along and film it, then I will tell you about it and describe it in detail. So that is it, and yeah, just wanted to kind of let you guys know where I've been and why I've not been very active on YouTube. I'm actually feeling, even though I've got all these crazy symptoms, I've been feeling better, probably because of the ozone. But yeah, guys, mitochondria, and that's what I'm gonna say, because healing the mitochondria at the cellular level is the answer, and we will prove it. Just kidding. I really hope that I can prove to you that that is what we need to treat to fix me and to fix many other people. So guys, even though I can't really do it, let's all try to stay hyped.